Hello, class. Tonight we're going to be discussing the medical nursing of pharmacology and specifically looking at the antihistamines of H1 and H2. Just for a little bit of a preview, I have a pretest that we're going to start with tonight, and that is going to give us a clear indication of how you've done with your readings for this assignment and what your understanding is of the topic we're going to be discussing. So let's take 10 minutes and do that. 10, 15, maybe 20 minutes. We'll give it 20 minutes to do that. And then when that is completed, we will come back and watch a film on antihistamines. I found a really good YouTube video for that. And then we will be going over the lecture for the H1, H2 antihistamines and reviewing what the receptors are and what the antihistamine drugs are. That's going to take us about 30 minutes to do. And then we're going to do a little bit of role playing. I have some scenarios set up with some index cards, and you'll get to pick an index card and role play with your teammate and figure out what drug is best suited for the type of symptoms that your index card tells you that you have. So I think that'll be fun. It'll help bring it home a little bit. After we do that, we're going to give you some time to work on your workbooks and do the histamine sections for that with your matching, the fill in the blank, and your case study that goes along with that, along with your nursing diagnosis and care plan. Sorry, I do have a cold, so I am trying very hard to power through this without losing my voice. Okay, so once we get through that, and that will take us up until lunch. After that, we will come back and we will have some time to practice alone with the information that you've been giving and questions and answers if we have any problems with that. And if there are any questions that we need to clarify or anything that you don't understand, we'll go over it at that point. And then we will have a formative post-test, and then that's going to conclude our lecture for the day. So we're going to get right into the lecture. We just finished the 20-minute quiz. Everybody did fabulous, by the way, because you're all very smart students and you did your reading. And they were pretty straightforward too. So the post-test will be a little bit more challenging, but the pre-test was just to make sure you had your feet wet. Okay, so let's get into what we're studying today. We're looking at the antihistamines of the H1 and H2 receptor sites. So, what is an antihistamine? First, we have to define what a histamine is and how it affects the body so that we can then understand what an antihistamine does, because it's the opposite. So, first of all, in our lecture today, we're going to be reviewing what that histamine is, how it is formed, the reactions, and how it stimulates and its effects on the body. And then we will discuss what the antihistamines are. Now, we are only specifically looking at H1 and H2. H3 and H4 are not for this category of conversation. And so we will be discussing how those antihistamines work and how they are specific to the diagnosis that we are going to be using. And we will review the names and dosages and some of the subcategories of antihistamines, because there are different classifications of antihistamines that do different things. And so we're going to get into that a little bit. First of all, what is a histamine and what does it do? It's a small chemical that's produced by our bodies, and it has pretty useful effects. It has some very important roles that include immune response, gastric acid secretion, but it also works in our brain to help us with our sleep-wake cycles and our cognition and appetite. It is present in most tissues, but it is primarily concentrated in our skin, the lungs, and our GI tract, which is why when we have an allergic reaction to something, those are the systems that are most affected. It's also pretty it's also generated by granules in the mast cells of our body. In the brain, it is let's go back. I didn't mean to do that. Where are we? Here we are. In the brain, it's a neurotransmitter that helps with relaying messages. In tissues, it assists with the immune response, the basophil and the eosinophils in the blood, and the ECL cells in the stomach lining for stomach secretions and aiding in digestion. So, what happens when we have a histamine reaction? First of all, our first exposure to an allergen, whatever that allergen might be, whether it's something that we eat and we're allergic to, like tree nuts or peanuts or milk. Well, maybe not milk. What else could we eat that might be allergic to? I'm totally drawing a blank right now. Nuts are primarily our issues. So peanuts are tree nuts, and they are two different categories because tree nuts grow on trees, but peanuts grow on roots under the ground like a potato. I don't know if you knew that. So it's treated differently because it has a different enzyme. It has a different antigen that it reacts to. So with our first reaction, with our first response to an allergen, the antigen reacts with the B cells in our bloodstream, and that stimulates the plasma to release IEG, or immunoglobulin E, which in turn then binds to the mast cells. So in a sense, our cells have been sensitized to that antigen the first time that they're exposed to it. The second time that they're exposed to an allergen, they're now ready to trigger. So the mast cell then releases histamines, which causes swelling, redness, and itching associated with allergic reactions. Our tissue injury is a second way that we can have a histamine reaction. A tissue injury happens when we have a cut or a scrape on the skin and there's damage to the tissue itself. So when that happens, the mast cells release their histamine, and that affects the blood and the nerves in the area, and it helps them to swell, and it helps to dilate the vessels so that the white blood cells can come out and have their immune response. But it also helps with flooding that area to fight bacteria, but it also helps with decreasing bleeding, but it also does cause our redness and irritation to the area. So a drug or a foreign chemical exposure, so something like a venom from a bug bite, or you can get a nice big welt sometimes when a yellow fly bites you, right? That's an immune response, and it's caused by histamine. So venoms, antibiotic bases, so things like penicillin. If a person is allergic to penicillin, this is where that would come in, and it's an actual allergic reaction. Or dyes, sometimes you can be sensitive to dyes, DYES, in fabrics, or what else can, alkaloids, sometimes like morphine can cause an allergic reaction. So these are all things that are caused by a drug or foreign chemical exposure. So your H1 receptor cells are responsible for the inflammatory and the allergic response that you get systemically when you have an injury or a histamine reaction. Okay, so how does this happen? The vascular epithelial cells, they make the blood vessels dilate. We talked about that a minute ago, just a little bit, and that leads to redness and inflammation in the area. It creates vessel permeability, and it leads to fluid leaking out and making watery eyes or a runny nose. Smooth muscle cells. Histamines also act on smooth muscle cells. And these are found where? Where are your smooth muscle cells found? They're found in your bronchi. So that's what causes the constriction in your bronchi when you have an allergic reaction and makes it difficult to breathe. That can sometimes lead to anaphylaxis. So I know with my son, for instance, who happens to be allergic to tree nuts, I know that if I can hit him hard and really with a big dose of Benadryl before we start that anaphylactic reaction, I can stop this reaction, and he never has to go to the anaphylaxis or the emergency room. So he carries Benadryl around in his wallet with him all the time, just for that very reason. It also affects the brain. Histamine affects the brain by making it more wakeful or creating an appetite suppression. It acts on the peripheral nerve endings, which this is where causes your pain and itching when you have a reaction. And the sensory nerves are affected by the sneezing and the itchy nose. So how does the antihistamine counter that? Let's look at that. So when you have a histamine reaction, the immunoglobulin IgE, we just talked about it a second ago, it binds to the antigen, and the histamine activates the H1 receptor. So that in turn activates this transcription factor that starts the inflammatory process. The H1 antihistamine binds to the cell. It binds to the receptor. It doesn't block the connection, but it binds to it in a different spot, making that cell inactive for histamine. It won't release histamine now. Just like, okay, that's fine. It just calms the system down a little bit. But the one thing with H1 and antihistamines that you have to remember, and this is a very important point, is that it crosses the blood-brain barrier. And when it does that, it creates other problems. So let's take a look at that. When it crosses that blood-brain barrier, the H1 antihistamines, this is when you get the problems with drowsiness, the cognitive impairment, or an increase in appetite that's often seen with the antihistamines. Oops, sorry. Okay, so those are the H1 histamines. There are two classifications. There's two generations of the H1 antihistamines, and we'll get into those in a minute. But right now, let's just continue forward and talk about the H2 receptor real quick and what the gastric response is for that. So we talked about H1, which is your allergic reaction, your immune response reaction. Now let's look at H2, which is strictly contained within the stomach in your gastric response. So in the stomach, there's a cell called the parietal cell. And all of the parietal cells are broken down into three separate parts: the acetylcholine, the gastrin, and the histamine H2. All three of these reactions go into what creates the activation of the gastric proton pump. Now, there are also proton pump inhibitors medications that you can do, and they work on this system from a different avenue. That's not what we're addressing today. We're only looking at the histamine H2 response and how if we block this category of that process, we stop the gastric proton pump from being initiated, thereby decreasing gastric acid secretions. So let's just talk about this very briefly. Parietal cells in the stomach. Three different types. Acetylcholine, which works on the parasympathetic nerve, and that releases calcium. The gastrin, which is a hormone, and it also releases calcium, but it also stimulates the ECL cells to release histamine. Those ECL cells that release histamine act on this histamine H2 cell, and that stimulates that. So what happens is when that cell is activated, it releases calcium AMP. That's calcium AMP binds with the calcium from the gastrin and the calcium from the acetylcholine, and those three actions is what activates the gastrin proton pump. So, H2 receptor cells, strictly H2 receptor cells. We block that reaction, we cancel the gastric proton pump reaction and decrease. We don't decrease. We deactivate the proton pump. What's the word I'm looking for specifically? It doesn't decrease the amount of acid. It restricts the amount of acid being secreted. There we go. So it has to be taken ahead of that protein pump being initiated. So, H2 receptor blockers, acid relief. What are those treated for? What does that do for our body? It's used with gastric ulcers. H2 blockers are the preferred agent because of the ease of use and the superior of the efficacy of its treatment. There's an 85 to 90% healing rate with a medication course over 6 to 8 weeks. Also, it's used with gastroesophageal reflux disease. Although the proton pump inhibitor, PPI, is the first-line drug choice for these patients, H2 blockers can be used, but they should not be used in combination. It's either the proton pump inhibitor or it's the H2 blocker. Okay, so let's look at some of those. So, when you're talking about the H1 receptor blockers, there are 2 generations of that, okay? So, the H1 receptor blockers are the medications that are going to be for allergy relief. They're going to be your antiemetics, the medicines that are being given for insomnia or for motion sickness. They all have very viable uses. They act as an inverse agonist, and they bind with receptor site that targets the tissues and inactivates or blocks the transformation of histamine formation. First generation antihistamines that cross the blood-brain barrier can lead to drowsiness and impaired decision making. It also can occupy other receptors that can lead to side effects such as dry mouth, blurry vision, urinary retention, hypotension, reflex tachycardia, and increased appetite. So let's take a look at those, just a few of those right here. We have the chlorpheniramine, which is used for hay fever. It has a less reliable potency. Some of these have less, moderate, or most. The diphenhydramine or the Benadryl is usually used for allergies, but it can be used for insomnia because it does induce drowsiness, and it is one of the most potent. Another one that we can look at here is the dioxylamine or Unisom. It is strictly used primarily for insomnia. What's another one here that we can look at? Oh, the meclizine, the Dramamine, the meclizine. Generic name is the meclizine. That is used primarily for motion sickness, and it has a moderate potency. The other one that I want to point out here that is rather important, you don't want to use the Generation 1 H1 receptor blockers if your patient has angle closure glaucoma, and do not use with pregnant women or breastfeeding women because it does and can decrease milk production because it's a histamine. And there are the side effects that we talked about: the dry mouth, the blurry vision, urinary retention. Okay. So, meclizine, motion sickness. Another one here that's rather important is the Phenergan. That is an H1 receptor blocker. It's used for motion sickness, but it's also used as a very potent antiemetic. However, you do not want to use it in combination with a patient who is on MAO inhibitors. There is a contraindication for that. Now, the difference between Generation 1 and Generation 2. Generation 2 generally does not cross or is limited in crossing the blood-brain barrier. So you don't get the side effects that you do with the Generation 2 that you have with the Generation 1. So these are medications that have been produced and manufactured by drug companies, usually mostly for seasonal allergies, hay fever, mild allergic reactions, allergies to grass or cat dander or dog dander or dog hair. Those are the types of allergies that we're looking at with this. So here are some of those allergies. Some of these that are rather interesting, the azalastin, is only available in the nasal form, and it does require a prescription. Odolpatidine is for itchy eyes and for allergies. That is an ophthalmic solution only and requires a prescription. And then the only other one that is ophthalmic only is the Zaditar or the ketotifen for itchy eyes. Okay, so these are your non-drowsy formulation of antihistamines. They are your generation 2, second generation. Okay, let's see. Yep, okay. Here we go. So, here are some other H2 antihistamines, but what are these used for? Okay, so some mild anti-allergics are the Zizal, the Claritin, the Clarinex, and the fexofenadine. These are all additional, these are H2. So these are ones that are going to be helpful with those allergies in those categories. And then we have our mainly H2 receptor blockers, which are your GI blockers, the Pepcid, the Tagamet, the Accid, and the Zantac. Now, there's only a couple of these, and there are some things that need to be remembered with these. Okay, the cimetidine has a drug-to-drug interaction for gynecomastia and galactorrhea, so that's an important thing to remember and to take into account with your male patients. Also, your ritonidine, Zantac, has been taken off of the market recently because of potential possible carcinogenic effects when it's stored at unsafe temperatures or above normal range temperatures. So really, they're very limited, and that's why one of the reasons that the PPIs, or the protein pump inhibitors, are the first line drug choice for the H2 antihistamines, because we're very limited in what we have available in these drugs. So, in conclusion, we reviewed what a histamine is, how it is formed, what its reaction is, and how it stimulates and its effect on the body. We also discussed antihistamines, the H1 and H2 specifically, and how they work when diagnosing what they are used for. We also reviewed the names and dosages of two subcategories of antihistamines, the H1 first generation and the second generation, and the H2 antihistamines. Here are the references for this PowerPoint, and I have my lesson plan loaded over here with a pre-test. So I will send all of that in, and I hope you enjoyed it. Thank you.